So now I'm walking from the front of the building where the main atrium is. That's the side that faces the hospital, through this nice big airy corridor that comes toward the back of the building towards the Cancer Center. Before we get to the main Cancer Center, I'm going to show you a new facility, and I'm going to ask my friend Doug Rausch here. He is the division director of the Hematology Oncology Department, and so he's basically the guy in charge. Thanks for helping us out, Doug.
You're welcome.
Behind me is the Wanzak Family Breast Care Center. The Wanzak family has helped support our breast care clinical operations, and so this is the place where patients will check in, and it's the public area, and then the exam rooms are in the back. Could you help us out and tell us what this new center is going to do for our patients for their breast care?
Well, when patients come for screening for breast cancer, they get mammograms, and right here we've got the reception area for mammography. If there's any abnormality, we try to solve what the question is immediately. There's radiologists behind these walls immediately reading the mammograms.
Hiding in dark rooms where they tend to hang out.
Right. And then if there's a questionable lesion, they get an ultrasound right away. And if that needs more attention, they can even do a biopsy on the same day. The scary thing about mammograms is you can find abnormalities. The good thing is 9 out of 10 times a suspicious lesion can be found to be benign, and then you just have to come back next year. So it's great to be able to get the mammogram and get your final answer before you leave this afternoon.
What a great service for patients. It's all team-based, and it's all right here in one location. What a wonderful new addition to the Hennepin family of care, the Wanzak Family Breast Care Center. From here, we're going to walk towards the further back of the building to the Cancer Center itself. So this is the Cancer Center's public area. This is where patients who are coming to see one of the providers or any of the healthcare team in the Cancer Center, this is where they'll check in. The desk will be here against this actually quite beautiful wall. I love the decor in the Cancer Center, Doug. Could you help us out to understand what kind of services will be offered in radiation oncology? And maybe you could start out by telling us what's a linear accelerator.
Linear accelerator is a device that aims a beam of radiation right at the tumor. And now the beams have gotten extremely precise, where they can focus more and more and more of the beam just on the tumor, but leave the surrounding tissue unharmed.
So this is the infusion center, and it's a little different than what we have now, which is nice, but this is really nice. So over here to my left is where the staff will be, and then the exterior wall of the whole building has got these individual glass-lined rooms with a lot of light, and they're beautiful. Let's take a look at one of them, and Dr. Rausch, maybe you could explain for us what happens in these rooms.
Well, this is where a patient would come to get chemotherapy or a blood transfusion or IV fluids, all those sorts of things. And across the hall, the infusion room nurses will really be supervising carefully to make sure everything is done precisely. Some rooms are more closed, but most of them are like this, where it's pretty open and airy.
So the infusion center is supported by the Haley family. It's just one more example of people who are stepping up and generously supporting the operations of our clinics. And the Haley family has been supporting the infusion center, just like the Wanzak family is supporting the breast care center. So thank you to them. Minnesota's most state-of-the-art cancer center for already one of the best professional teams of care for cancer. So I can't wait for next year.
Same here.
Thanks.
Thanks.